The divide between good enough and getting it right has never been so great. But anyone can say they do what's right. At Mylan, we transform words into actions and simply say, see for yourself. See inside. See inside our innovation with more than 1,000 products worldwide. See inside our quality, an ingredient in each of the 45 billion doses we can manufacture. See inside our leadership, where we champion policy that can one day impact quality standards all over the globe. See inside our passion to bring life-saving treatments to those in need. See inside Mylan, because 7 billion people depend on our employees to get it right, and we refuse to let even one of them down. But don't take our word for it. At Mylan, seeing is believing.
Hi, I'm Rob Eder, editor of the Drugstore News Group. My guest today on DSN Executive Viewpoints is Larry Merlo, President and CEO of CVS Caremark. Larry, welcome to the program.
Rob, thanks for having me.
Larry, you know, there's no doubt that CVS Caremark is a unique company, unique both among retail pharmacy companies as well as pharmacy benefit managers. You know, in your most recent earnings call, you refer to products and services that are extremely difficult for standalone PBMs or standalone pharmacies to replicate. Can you talk to us a little bit about how CVS Caremark is unique this way and why that matters to patients and payers?
Yeah, Rob, as you think about CVS Caremark, we really operate three distinct businesses. We have our CVS Pharmacy retail brand, almost 7,400 stores now across the country. We operate Caremark, one of the leading pharmacy benefit management companies, and we also operate MinuteClinic, now 650 clinics across 25 states and the District of Columbia. Those three businesses, while they operate as standalone business units, when they come together, there is, as you described it, and as we call it, an integration sweet spot that allows us to capitalize on, each of those business units to bring products and services into the market that address some of the challenges that we face in healthcare today, and those challenges, or those solutions are really addressing the challenges of increasing access to pharmacy care, at the same time improving the health of those we serve, as well as lowering the cost of care for payers as well as consumers.
We think about health reform and where health reform is going in this country, and I've written for years, I believe that in the future, providers, all stakeholders are going to be paid and compensated on their ability to improve patient outcomes. Can you talk a little bit about how health care is changing, how the landscape is changing, and how this integrated model kind of puts you guys in a unique position to be able to move the needle on patient outcomes?
Well, we're seeing healthcare changes, Rob, every day. First of all, costs continue, to rise, and as you mentioned, that is going to be a critical component, to healthcare reform, that we have got to take costs out of the system. You look at the fact that baby boomers are turning age 65 at a rate of 10,000 people every day, and they take 3 times the number of prescriptions as the younger population. We do not coordinate care across the healthcare delivery spectrum. We're beginning to experience the shortage of primary care physicians across the country, and that's expected to get worse as we go through this decade. And as a result of continuing rising costs, the consumer is going to be in a situation where they're going to have to bear more of the cost of care. At CVS Caremark, we see opportunities, again, by leveraging our integration sweet spots to bring products and services to market that offer solutions to some of those trends that we see that we're all concerned about around healthcare. And those products and services, Maintenance Choice, Pharmacy Advisor are 2 of our flagship programs that have been in the marketplace for a few years and are resonating with employers, with health plans, and with consumers in terms of improving the quality of care and at the same time reducing the cost of care across the system, and we're quite proud of the results that those products are demonstrating.
Pharmacy Advisor is really an interesting program because it seems like it's enabling you guys to deliver a lot of the MTM type activities and services without wondering how you're going to be paid for them. Mm-hmm. Can you just talk to us a little bit about Pharmacy Advisor and how that works?
Yeah, Rob, as you look at some of the statistics across the country, almost 50% of all Americans suffer from one or more chronic diseases. As we know, those chronic conditions oftentimes are accompanied by prescription therapies. It's been written many, many times that the cost of the lack of adherence or non-adherence of prescription medications is costing our healthcare system almost $300 billion a year in unnecessary medical costs. And Pharmacy Advisor is a product that enables us to keep patients adherent to their prescription therapies, and at the same time identify gaps in care for diabetics, and to work with both the patient as well as the physician in terms of closing those gaps. What we have been able to do is by investing and utilizing technology, we have been able to build those interventions as part of the prescription filling process for pharmacists. So we're able to deliver to a patient, whether it's in our retail stores, over the phone, from someone who's using our mail order pharmacies, or someone who's simply calling one of our call centers for information, that we're able to engage that patient in a very brief but very succinct conversation that may last a few minutes, again in an effort to get them more compliant with their prescription regimen, or perhaps identify a gap in care and work with their physician to close that gap.
Larry, we talked a little bit about trying to hold down the rising cost of healthcare and how that's a critical challenge facing America right now, and all payers. Specialty pharmacy is the fastest growing piece of overall pharmacy. It's growing incredibly faster than the rest of the segment, and all the new drugs are a lot of the new drugs are in that space. It's certainly an area where payers need more help. Can you talk a little bit about some of the things that CVS Caremark is able to deliver on the specialty side to hold down costs on that level? I think it was 3 to 5% of America, I believe, I just heard recently, was on some form of a specialty med and growing.
Yeah, it's a great question, Rob, and you're spot on with your comments on specialty. And there are two elements that we're focused on. One is again utilizing our integrated assets to deliver what we're referring to as an integrated specialty solution. In an effort to help bring costs down, and at the same time, once again, keep the patient more compliant with their specialty regimen. The second program that we're working on, in terms of an awful lot of feedback from employers and health plans, is there's an element of the specialty pharmacy spend that within a health plan or within an employer's benefit programs do not fall in the specialty segment. It falls within the medical segment, and to a large degree that has been unmanaged, and we're talking about oncology treatments, and we have a pilot program underway that allows us to work with the employer as well as the physician and certainly the patient in terms of bringing some of the same tools that we have learned from managing the traditional pharmacy spend and bringing that to specialty in an effort to reduce costs while ensuring the continuity of clinically appropriate care. And the early results of that pilot are showing that we can take anywhere from 10 to 15% of costs out of the system, while again ensuring clinically appropriate treatments.
Larry, thanks very much for your time.
Thanks, Rob. Enjoyed it.
I'm Rob Eder. He's Larry Merlo. Keep watching.